My name is Mundaka John Bosco. I'm a doctor by profession, and I'm proud to be part of this great family, Caring Hands. It's a charitable organization started, of course, in 2010 by our great president,
Charles. I work emergency medicine in America.
The main funder of the whole organization. I happen to be part of the medical arm. Caring Hand has more than two, actually about three arms. There's evangelism, the medical mission, which is the medical arm that I'm proud to be part of. Of course, there is a lot of education, and in education there's a lot of funding that basically Caring Hand does. Now, Kasensero is really far in Rakai, and this started as really a simple visit by our president, Dr. Holt, who was introduced to this area by Professor Rajid. There was really big need. If you happen to read the history of the area, many people say, or many people put it, that HIV, or the first case of HIV, was actually identified from this very area. If you visit this area, the need is big. Sanitation is not good. There's really a lot of HIV. There are a lot of conditions or diseases, and people are really very needy. So this touched the soul of the Caring Hand family, and this really members sat and decided on what best they can do to reach out to the people of Kasensero. It was agreed upon to at least run an annual medical camp. We had our first successful medical camp in 2012. We happened to see over 1,060 patients, and these were of all ages. We saw all kinds of conditions, and the findings were quite interesting. The district was so interested in us having these camps on and over, but as well as a family of Caring Hands, we agreed to have it annually. In 2013, we again had a very successful medical camp in Kasensero. Just of recent, in 2014, we had a very successfully organized medical camp. We had a theme for this camp, or this year's medical camp. It was caring for the community as a whole. And just to add a spice of all this time round, we wanted to have a special attention to the female with their gynecological conditions. Well, I'm a gynecologist in making, but we also invited a lot of gynecologists that came from US, that came from Uganda. We had quite a big team. We had midwives that came from Gombe Hospital, and these really did a very great job with screening, that is cervical cancer screening women of any kind of conditions that they could actually have. And this actually involved treating. It's not so easy to get a camp that actually treats cervical cancer, especially in its early stages. And this was really a very big boost to this camp. This time round, we saw about 1,700 patients, and these included all ages, women, men, children, elderly, some of which we actually referred to the nearby health centers, especially those that had chronic conditions or those that needed to be followed up. This camp, we as well went with a big group. We had the evangelic team that really did a big job in the spiritual aspect. We went with counselors, and interestingly, we actually went with spouse or marriage counselors, and these did a very good job indeed, aside from the medical care, because in medical aspects we had about 7 sections. Well, for the medical camp, we of course invite our fellow members or colleagues. We try to organize it about 6 months earlier. We visit pharmacies. We try to visit friends to contribute anything they can have for our brothers and sisters in this area. People can bring as little as clothes, and these have been really a very big aspect in the care of the patients in Kasensero. Now, however, the biggest contribution always comes from the organization. Of course, the budget is always big, but yes, we really appreciate the services or the offers that we get from any interested parties or pharmacies. Just to take us through what happened in the medical camp, we had several units. We had the dental unit, we had the eye unit, and this was manned by over 3 opticians. We had the pediatric section. This was manned by a pediatrician with some other clinical officers. We also had a hearing section. Now, a hearing section was manned by Stuckey Foundation. This in the previous medical camp really did us a good job. They had about 35 impressions of people who actually had hearing defects, to which they actually offered hearing aids. And this time round, the turn-up of patients was actually very big because of the previous medical camp and what we actually thought. The other aspect or the other units in the medical camp included the screening or the female cancer screening, and this involved screening of VIA, screening cervical cancers, breast cancers, or general health of the female. And in here, we had a visiting professor who as well screened and taught our own midwives and nurses on how to carry on that aspect of screening. Other units we had were laboratory. This was really carrying out most of the serological examinations. We also had a big pharmacy, and this was run by over 6 nurses. It was a huge one. The stocks were big. And this time round, the organization was so good that the lining of the patients are waiting for the drugs were actually less. We had about 4 examination rooms. These were manned by doctors who were evaluating and seeing patients. Of course, we had 2 registration or entry point, and at that point we had triaging, where patients were sent according to their priorities or critical condition or state. We had an HIV screening point. This was run by over 6 nurses from Gombe, and these basically carried out a package of HCT. Well, we had an examination area, and this was basically put to highlight a few aspects or just to evaluate these patients who come in a few parameters, like taking their temperatures, taking their pressures, just interacting with them a few as they await to be evaluated. So yes, the camp was so successful. Our future plans as Caring Hands, we have confirmed the annual event. This medical camp is always going to be an annual event, and it's going to carry on and on. But like as a family, we're always thinking of expanding, and we're thinking of reaching out to other Ugandans in other areas in taking out this aspect of care or the medical care, to reach out to other units, to other districts. Even around Kampala here, we are planning to reach out. And as per these very camps, we are planning to add on more units, to even do more surgeries, to do more operations on this medical camp, to take care of any kind of conditions. We're even thinking of the emergency response, because we need to transport this critical care on that very day. Caring Hands runs a website, and on there you can have, you can donate, you can as well get involved, you can get registered, you can like us, you can always visit us, get to know what is happening, and we shall always keep you updated.